Iqaluit, everybody. It is Monday, June 14th. I will be filling in for Premier this morning. I inadvertently double booked him. So I am here. Dr. Patterson will speak after. Minister Iqaluit is graciously stepping in to be our interpreter, and he's also on hand to answer any questions. Thank you. In his capacity as Minister of Economic Development and Transportation. So I'll just get right into it. Good morning. Premier Savikata is meeting this morning with his territorial premier colleagues, so I'll be filling in. We're announcing no new cases today. There remain 9 total active cases in the territory. So far, 18,009 people in Nunavut have received their first dose of the Moderna vaccine, and 15,808 are now fully vaccinated. Premier wanted me to remind all Nunavut that the COVID-19 vaccines are our best protection against the virus, and that with the Pfizer vaccine clinics starting this week, he's hoping parents will make appointments for their 12 to 17-year-olds, as well as themselves if they haven't been vaccinated already. As you saw yesterday, Iqaluit Middle School is open today for their Cohort A students. Contact tracing is ongoing, and students and staff that are affected will be swabbed today. Depending on those results, we'll determine how to proceed tomorrow, so expect an update on that later on. I'm a parent. I do understand concerns about the safety and well-being of our kids. However, a lot has changed since the development of the school reopening plan last summer, and over the school year, we have really learned how to determine how to handle cases with the availability of the vaccines and evidence-based practices. In other news, I'm pleased to let you know that the Chief Public Health Officer has worked closely with Agnico Eagle Mines to approve a protocol to have Nunavut employees from the Iqaluit region return to work. The return to work process will be voluntary to begin with, and not all employees will return to the site at the same time to ensure a gradual approach. Agnico Eagle Mines will be reaching out to their employees directly and hope to finalize their plans over the next 2 to 3 weeks. To wrap up, I'll say what Premier always says at the end of his updates. Mask up, wash your hands often, keep strict physical distance, keep your bubbles small, get vaccinated, and now help your teens get vaccinated too. Stay kind and positive to one another. Do the right thing for yourself, your family, and everyone around you. Take care and stay safe.
June 14 goyo tabani simule okti butamani gunang imma Cate Macleod kamatan Kate tasuming unikar natangani unikarsuni amalu tan Dr. Patterson tamana twinno naradluni ulipi katamani gunang immat ulipi kamu kingu beras kenang naratanga ayo arwarlungon ni ila tema udlanguyo Premier Savikata sibule oktibut Cate Macleod udlumi Premier katingini tabani gunang isuni takot kanwili opadlianing ni tusak titina suktu udlumi nutami nuwarna tuami tamang waktuhang nisuli manoyok 9 nguyuit takot nuwarna tuami atuktaw si mayuit tabani takot 18,900 inuit Nunavut si udlumi kaputi mo kapuyaw si marakpon Moderna vaccine muna tayo amalo 15,808 man makon at tamakin ni kapuyaw si maraksutin si uliw tivot ikait tiyaw mawo takwa Nunavut may talima takwa Nuvarna 19 kaputin tan piyo nakpangom matasaminga tamaw nga teliman namon takwa lo niriw naksidluti Pfizer sakanya lakti tamane penso samin takon anayokarayo yun takon nga ati atwin na wakti tinyala po si nutakasinit akagolin nito ini 17 nun ang malo namin pinasugun ng nayalitin tayo kapoktaw si yaking ikusi kayo ipasak ta kulo kasi ta naaksam ni ilinyawin udlumi matwingan yatok ta kuno nga na titarak si mayuno ilisayino ta ko tan kayo sakta nginang nasuti ta ko ilisayi amalo ilinyaki tamani udlumi yok kayo sakta ni amata ta ko tusak vigiti kanong kanwilingan itu sabi utiut kapat kanok tora kanong natu tan tusamat tinang napun ana yokare yodlunga te man tukisi matiatunga isumalu tugun ta ko khanu ngi khoy tiaka tigo nu ta khotivun kiseni ta ko aji gumne padliang namaila tamane ilin nerve akago yangani tamane lo khawi badliang naksuta kisu kapotiru amalu kisunu saput miyaw yun nam nitinik tukisi mo badliang do tate man piliribugun asya go pimadliang kun kowe asukta punga tana luta do khotivun pilir khat semama ta kuninga agni ko ego minds nin taiman na angek semalakpo angek utimin ta ko Nunavut mute kanayak tingin te kanik kiwadlamit utak padliagon ng neramate kanayak bingan nun ta ko utak padliagon luti kanayak bingan nun isumaksok titaw kay ng nertu pigyan ningani kiseni ta ko tamak kilima utikaw tigit tu ataw tikun ak utak padliagon nguyak nersutin agni ko ego mind kun ta kununga kanayak tingin nut tala tusak titiwadlia lang natui kanok parna si mayangin tamane penso si mako pingaso si pingasunidlunin tema ukad lagi padlia lang lunga ta ko si buliok tita ukaw sa rin na yaktangin ati matuak si magakatasi agasi wa sa katasyo unga sige kataw tilusi amulta katinya ko si mikit amisungid lusi kaputi mo kapiyaw yak tiasi amalo makutto ko tisi kaputi mo upakot tiar na pasiyo temen na itidlugo kowe aso katigit tiarta amalo pilir katigit tiarta ilagay tigot ila tidlo namituin na kowe pakit tiarasi amalo tem inu tiarasi.
Good morning. In Iqaluit, public health continues to follow up on the cases of COVID-19 that resulted in exposure notices last week, as well as the new cases announced on Friday. After extensive testing of contacts from staff and clients of the boarding home, we have had no additional positive cases of the virus, and there is no evidence of transmission at the boarding home. As a result, medical travelers can start going home as early as today.
Ulakun Iqaluit ane khamnang itulagikun kayo sinapon kawi sakpadliangan naksutidlo tako November 19 tabani sakilaw ningani tako makko idluni kan upataw si mayokang pat kawi tusakotimi sakilaw at pensuaw si urokimi tabani lo tako nuta ngurokti sakakatani ko tabani udlutuin namin tako amisunin kawasak laumata tako na ikanayak tinin amalo ane avalak sa mayunit tay kanitang maktakvimin tabani nutamit nuvarnadramot nutamit sakit to kangiman amalo tako say maktitaw ningin matabungat tamaktakvimin tay manetilugo tako ane avalak we
are also not aware of any transmission due to the emergency room exposure notice. We are contact tracing and asking people to get tested if they were there. Testing can be arranged by calling the COVID hotline, going to the Cadet Hall walk-up clinic, or to the mobile testing unit around the city. Regarding schools in Iqaluit, we are expecting results from swabs taken from classmates and close contacts of 2 cohort B students at Iqaluit. If any of these tests come back positive today, we will reassess the school opening in a manner that reduces risk and allows students to continue education.
Say maximangitude te kani anevi la octude te kani utlokotingin kawi saktaw ya khalawtani ta ko qaw saktaw tilugit ammalog inuit aperilawtavun qaw saktaw lutigon te minna ta te kanilaw ne rossi tan qaw samni ak qaw saktaw yuman ne rossi ta ko te kunga tarafo mod novanna tarafo khotano te kunga tarafo naktusi o bolonni tapunga kada khamo pisu lusi te kunga isitu ndauna lute o bolonni te ko nuna repao yamit qaw sak view katatui nuna siutiu ilonitum tan piddu tikitlugo ilin nerve iqalonni tapani nireutugo ta ko qaw sakta dutingin ta konanga ilin yaqatingin ammalo khanigi yangin neut ta ko qadlonati tut cohort B ilin yaqti te kane aksarne ilin nerve ta ko qaw sakta dutingin tapani qaw sakta ningin pitakakto kakalapan tayo kanokto sikaw tiginatugo tana ilin nerve matuingan ninganin amalokano tayo magkuhan novana dra mo tikil tayo liman mo tako lo ilin ner tikore ilin nangin nakulutigo ilin nerve.
The Department of Health does regular surveillance testing at schools to help ensure that we can track and contain the virus quickly, and this surveillance testing will continue. This week, youth vaccines will start rolling out across the territory for youth aged 12 to 17. Youth who go to a clinic without a parent will be assessed by the nurse to ensure that they are making an informed choice. If the nurse feels parental consent is required, the youth will be asked to come back with a parent. Appointments can be made by calling the health centers. Information on the clinics is also available on the GN website and posted on community social media pages.
Ania khamnang itulrikut qaw sakate na hatakput tapani ilinyar binnin ta ko temna novana to tabunga semak khunatigun temne tilugo tamani penso asamin makutui kapoti makutunu kapoti pigarner mata Nunavut mamen ta kununga makutunu aqagolini toyamit 17 mun makutui tek ngarnarnerpon anevimun ana yoqag nganit piqatiqangito agotit taana qimikoyawnertu anniasutimun taymanna tukisiumattiaro matakia taana kaputi missanu ta ko anniasuti ipigusukutit ta ko ana yoqangin angi khatawga ham nyapata tayman an makutto ana qaqtitaw kanarluni ta ko nga ana yoqangin ni piqatiqarluni tayman pinasukkan nerunarnertuin tapunga tarafu katagom nak tiyusi aneve qotissinno takko qimiqaage takkunani atuinna mata ubbaroni Nunavut gammakku qasaw yaqabianin ammalo tamakkuninga takko atjigingituni saqqiyaaq bioqattaqtunu.
Beginning today, individuals who are fully vaccinated no longer need to isolate after travel. This decision was not made lightly. It was taken based on current evidence and is part of a gradual approach to easing measures that ensures the risks of introduction and spread of the virus are reduced so that we do not inadvertently create a situation where we have multiple outbreaks across the territory. Nunavut's under 18 population is currently unvaccinated. As youth 12 to 17 get their vaccine, and as more adults complete vaccination, the risk of getting and transmitting the virus will drop significantly. In addition, current public health measures, including mandatory masks territory-wide, will help reduce the risk.
Udlumi pigyasugo tinatuinna kapoti no piyareksima doktumen tabani utakivimiga katajagon nito kangatanerone tan isimasaksyoksutigo aksuru tigilaw pavu takuat lo kemi kuat yak sutigu tabani kisui atulak tawat liagi kanui lok padlianing ini amalu tuavan nago dan sakit padliayavun tamakuat kawai sak padliangin naksutigu takuat ulugayan ako tahu tuin nagali sakit padliatil dan nuwang nakdo sa makungitiak nitinu tayo manetid lugu tamakuat kemi kuat liangin nakpavun takut lo akit ya sunak pabut tamak kuat aji itu ni tamak Nunavut mi saya mak toka tayo makadutigon akaguli 18 tunganin mana kapok tau sa mga mata tayo manetilugo magkutui toyo ni 17 mo kapok tawad liarak tilugit amalo inay piyarik padliarak tilugit kaputi mo takut Tana ulugayan ako ta mikilit juak tawad liyan niya matana nuwang na tuwa kang kuni kudlutigon ilagyak kanak sutigon tamagkuhan anya kam nang itulagan mo ato ko katatawot so lumatwa si magayakam ni tayo manetilugo ikayok juak niya to taso mga sa imak ninamon.
Finally, I would like to encourage everyone to get vaccinated, and I urge families to talk to youth about the vaccine so that they can make an informed choice. Please make an appointment to get your vaccine for the health of your family, friends, and your community. The higher the uptake of the vaccine, the lower the risk and the better our chances to ease restrictions and reduce the threat of COVID-19. Thank you.
Kikulima okad taso mga kaputi mo pikawara pasi amalo ila siniwe si okad lakati gigisi makutokoti sini tan kaputi umisano tamako pilawan ni siniwe si kawi matiarlo si kisum pinyaga sikia temen netidlugo kako talafo katarisi temen kapok taw gumalusi tan ikayok naman ilakotisino pekatisino nunalisino tamakuat amisonak sein kapok taw sa malakotit tan mikilan juan naman tan tako nuwan na tuwa tamani gumni nagsawluni koyan naman.
Ken Driscoll, EPTA National News. Dr. Patterson, parents were starting to get reports on Friday night about the positive school cases at the middle school, but your department didn't announce it until Saturday at noon. I'm wondering why the amount of time in between.
Ken Driscoll, EPTA News Mingato. Ana yung kariyo yi tu sak padliara raw mata udlutoy namin kanoy man sivatawin mo utakilaw pisi.
Working through the Department of Education, there was the announcement that were sent to parents who we knew had been directly affected, and the work on Saturday was to really figure out what degree of risk there was and what the plan going forward was going to be, and that meant that we couldn't put out a firm announcement on opening for Monday until sometime Sunday morning was when that plan was finalized.
Tako pilih katigid lutigod ilinyatul rikon tako ano yung kariyo yi kaniliyaw na pango yung bonita ko sa mga nubar na drama at tuktaw ito sakti taw pagilaw sutin tako at kimik ko kaya karawat tigo kanutigi ulukayan at tigim makia ang marupang natiyak sa mayumpak na kaya kasuta tayo manitid lugo tako at pilih rayawot akit tiyak sa maglatari tayo nakitid natin ngayon sakit tayo naraw pa po.
Dr. Patterson, what I was asking about was on Friday night when you knew, and then on Saturday when you informed the public. I wasn't so much interested in the school opening. You had until Sunday to decide that. I'm wondering, since the health department and the education department knew on Friday night, why did it take until Saturday noon to let the rest of the town know?
Dr. Patterson, kayo malilak sa siyo, lutuin na ununganit, tako ilinyati, tayo nuwar na tuwa katilugit, kano'y siwatawin mo tukar tilugit kasi tusaktitin na sulit tayo na opisin nunalin.
Again, we had to make sure that the individuals who'd been directly affected knew first before we made a public announcement, and so that was our first priority.
Ukare kanulunga takwa kanilang orok tweet amalutay ko nawan na drama pikam na katawag tweet tusaw makare laumata terminated lugu tusak tikarok suta tamakuninga tema nunalino tusak titililapugun.
I'm trying to the Canadian Press. How many contacts have been identified with the positive cases at the middle school? How many cases how many contacts with the cases at the middle school?
Emma, aperiok kachiovan takonunga atoktaw samawan takonovan na dra ilnya viloni.
As of this morning, I think it was 21.
Tako 21 ngoye kawsaktaw yareli ilnya vimilok.
Through contact tracing, have you found that these cases are connected to the new cases we saw last week in Iqaluit?
Tako kawsaktaw ni kawsakatagasyon ila na katingan matakir tako ilinya tuin kating ilagay Europa tako nga nutam ni sakit padler tilugi.
Yes, both of the students who have been diagnosed with COVID-19, it appears that they acquired it at home outside of the school.
Tako mako ilinya tu kawsaktaw tilugi anakanganit nuwam na drakta lokto tabunat ko na kawi lokpavun.
Tobi utak CBC kuni tawani nuruyani 32 ni ikanayak tini nubagjuang na kang nakaktaw si marong matakwa Delta variant they kang nga awdani tigdugi kasi ni ay tukloy si mariraw pat nubagjuang na kang nakaktaw raw ni tigdugusuri. You have confirmed that 32 workers from Mary River Mine tested positive with the Delta variant after leaving the mine site. How many people did they infect before they tested positive?
Sorry, we don't know. That's happening in the south in other jurisdictions, so we don't keep stats on transmission that happens outside of Nunavut.
Mamaya naktakot kadlunani kawisaktaw katamata takot kan amisun ng ini te kununga aurataw nga mata uwaw namin kawi mangituli tapanin Nunavut ilon.
Te manno pat Nunavut mit kawi madluak pa kaninang mga tana uyang napik. Because of that, will Nunavut know what will happen with the mining site in Mary River?
Yeah, right now, what's happening at Mary River, there's no COVID on site. There's been no active COVID on site since June 5th, and the last diagnosis of COVID, the last time that transmission was confirmed to happen on site was May 29th. Workers, Nunavut will be able to return to Agnico Eagle as they work out their plans. We want to get Nunavut back to work at Baffinland, but that will happen when we're certain that it's safe and there's that this outbreak is over.
Manoila nuwarna drakta hangit to taikani nuruyani taikani King of Pangolok June 5, and Molokaria Parok taken in May 29, terminated Tatuni. Terminated Lugutako, Ikanayatiyo, Agnico, Ego Mines, no, Piga, Utapadlea, Gumnaxinera Mata, Kisitana, Nuruyani took Manoyok, Tako, Pilario Samaji, Akatero Lutikas Tamakot. Isumaraw na ako yung anigok patikisyan tama kami ko unang naktabudli nuruyano.
Dustin Paterno, Outbreak News. How many of the cases are related to the first case that was announced on Thursday?
Dustin Paterno, Outbreak News. Kachiyo na pagtako, nawan na drama at 2000.
It's either one or two that are directly linked to that first new case.
Tako ataw sa ubaron ni Mako tayo na sibudlapa nan sakiratarok to ngayon.
Do you have links for all the cases that have been announced in the last week?
Tako kat manoyo nuwarna drama at taw sa mayu tremen na at kano at taw sa ma nikuvan.
Yes. Sorry.
You're getting rusty on your interpretation.
Trevor Wright, Nunavut News. Toby mentioned the Mary River mine. How widespread was the outbreak before we started sending people down south?
Trevor Wright, Nunavut News Mingato. Katsurilaw patakot nuroyani ki nuwarna dra khartilugi kawiyaw naktilugi.
I can't remember the exact number that had been diagnosed on site, but it was 2 or 3 dozen at the point where they were transferring people south or sending them home.
Nasa tidlangin ikaman nga kisenta ko mako pingasudluke amis katsu dozen amis sukat lardu anak kaftau kau tigilaw tu tamak ko nga nuwarna dra khatuni pekhalray mata.
I noticed a couple of Department of House staff at my building, 4104. They're in scrubs and all that. What was going on there?
Tako idlokoti ni wanga to take on 4101 mi pilere ro yala mata kisum ko temne jut karapan.
I assume they were going there to swab somebody in the building.
Temen na kay isa magaya nireyo gaya kay lata ko nuwarna dra mo kaw sakta sa Europa.
Kent Driscoll, EPTN National News. Dr. Patterson, I'm wondering about the contact tracing at the middle school. How close a contact would you have had to have been to the 2 students in order to be contacted for tracing? Like, I'm wondering, same class, same bus, same cohort, how wide is the net here?
Kent Driscoll, APTN National News Mingato. Tako kawasakto yun aksan mi ilinyawin mi kanutigi kanitiri gayakarapat tako kawasakto gayakalutit tako ilinyakatilimangin idlo samin idlo ataw samin ubroni teko na basikon kanutigi kanigi tuit kawasakto.
Right now, this morning, the priority is swabbing everybody in the class who hasn't yet been swabbed, and they're still figuring out who on the bus might be at higher risk of exposure.
Mano yok tako ilinyavio iloni lokti tako ilinyatulima tako taken ilokti kawi saktaw naksuti man nasuli kawi nasuktugun tako basini ilokti kanutigi kya kanitigi ilaw matakya.
Dr. Patterson, the students are fairly easy to keep apart in cohorts. You can split them into the 2 groups and send them on opposite days. Both cohorts have the same teachers. I'm wondering what special attention and what special challenge is it contact tracing with the teachers involved teaching both sets of students?
Dr. Patterson, tako piyam na tuwing ila ilinya tuwing avik tok si magom naksutingo tayo man avik tok si mamata kasi ni ataw sa ilisay kakatang mata tako adli kanok tok si mabisiyo ang malo kanok kawi na sukpisiyo ilisay ingin kano ili yaka kakasiyukya.
If there's any doubt about the risk for staff, especially teachers, they'll be asked to stay home until we can sort it out.
Tako isumalo tigiyaw kada pata ilinyati tem kanigiliyaw kada na pata anak kaksimako gayak tabu tako ilinyati iliseyi mameno.
I'm going to the Canadian Press. Can you tell us which variant these new cases are in Iqaluit?
Canadian Press kuningato kawi mavi kanu nadliang makiata na nubar na dro kichumi atakam makia.
No, the turnaround time for the variant testing is a week to 10 days, so we won't know probably till later this week.
Kasuli kawi lang tigo tako kawi sakta jutingin pintua ko sila mamun ubaroni udloy kolino tayo man natigi ako niyo tigi yok tusang nakatangin mo.
Can you clarify, I know we've talked about this a bit, but why the middle school wasn't just closed today? If swabbing is still ongoing, why not close it for a day in order to complete that testing before assessing?
Tusakaya tijumila tigo to tana kanwi man aksane ilinya we matu yaw tu nang imakya kanwi man kawi sakta yokakti ligo matu ingatik pisiyo.
Because the cohort attending today has no crossover with the students who, the cohort that is affected, and so there's no reason to harm their education today because the risk is minimal.
Tako avit toktaw si maningin avit toktaw si maningin tako ilinyakti avit si maningin teko at toktaw ng mata ilinyangin nakodlutigot tamakot kayo sitabot. Kaya man na ilinyang ningin at suk kay gumalo suk kano kinguwa titi gumalo ang natatako temen na itidlugo uluwayan ang ninga mikim matak temen na avitaw tis matidlugo.
And again, there's on social media there's a number of comments talking about Iqaluit having an outbreak in the school. It's not. There's absolutely no indication. In fact, we have good evidence that both students acquired this outside of school, and it had nothing to do with the school in terms of how they got it. So there's no reason to think that the other cohort is at any risk, any increased risk because of this information.
Teko kakasaw kun sulingit tiyato niya si sakit tilaraw mata tana ilinya big tamakyaro go tem neto karon na todo ni tana sulingit tiyato temen na kawi madlutigon kawi lutigon lu tako ilinya to kurit anak kangani temen neto taraw tu ilinya bimi temen neto taraw ngingin ni temen neto lugu tana lo kawi yaw sa lindingano temen na matung ikay nakalwal dugo temen na isim akisi mayavut takwa nakingal niko ningin tamakwa kawi sam niko kawi wadli akatakatigo.
Some Patterson at CF News. Do you have a breakdown of how the 8 cases over the last week were detected?
Takwa nuna CF News mingato takwa 8 ngoye kano kawi yawra matikya ukakaya kunapi.
3 were detected because they presented with symptoms, and the others were detected through contact tracing.
Tako pingasu yun nuwarna drama temen na nuwarna drama mo at tuktaw sa maningin ni sakya suti temen na kawiyaw lakilaw tuin asingin tako apersuktaw luti kikun kanilaw ningin ni teko temen na ngayon.
Travelers can start going home. That means obviously you prevented them from going home. When did that start?
Ukakata witako ane avilak sa mayuit anakakon naksinaksugin kanga nukaktilaw pisi.
I think we made that decision Friday morning when we became aware of a possible exposure at the boarding home. And over the weekend, staff collected and processed more than 100 swabs from boarding home staff and clients alone, and have not identified any new cases as a result.
Tako udlutoy na udlanganin nukaktilaw tavun tako kawi saktaw tiya udlutigo tamani nukangan na ilanganit 100 ungatani ti kawi saktaw roktuit ane avilak si mayuit amalo ekanayatingin udlumimot tamani nutami nuwarno drama sakit to karawin to.
And just to add to that, high-risk contacts are still in isolation, and people who return home from the boarding home will be expected to isolate for 2 weeks on returning home.
Tako ilagay ka ng lago, tako kubbasit tumi la kanila rihatigila okti tako suli anak Cate Macleod tiyak suti amalote ko anak karir si mayuit o kaudyaw si madluti anak kami anak Cate Macleod kay nakasi narok taili kai narasita mo no ka Jose Mayita ko.
Trevor Wright, Nunavut News. You mentioned for youth vaccinations, youth would be assessed for informed decisions. How will these people be assessed? Like, is there a difference between a 12-year-old and a 17-year-old wanting to get a vaccination on their own? Or?
Look, Trevor Wright, Nunavut News mi ngakto. Tayo mo no kakatara with kawasaktaw niya mata. Tako Nunavut mo kaput pinasugo mayo ito yung may 17 mo akagulid. Kano kawasaktaw niya pasiyo. Kisuni kano akagulid toyo amalo 17 mi akagulid adji tijangi pasiyo.
Staff will be asking them questions to ensure that they understand what the vaccine is for, what the purpose of it is, what the benefits and the risks of getting the vaccine are, and how they compare to the risks of getting COVID infection. If they're able to answer all of those questions appropriately and that clearly demonstrate that they understand what's happening, then they'll be allowed to get the vaccination.
Tako kanaya tigiya ana kanang ituloy kunun apeksok na atu itako ni makutunin kisu mo kaputi una kisu kaputi makia kisu mo atu takang makia amalokano piu ninginit ubaloni ulugaya nang ninginit kawi matia ro matkia tako kiu katagon napata tayo manaited lugo tako anya suti kayu tinapon ubaloni anya kangin utatitaw napon tayo tako nga pilagan nato.
For parents who are concerned, number one, they should talk to their children ahead of time, and they can still go with the children to the appointments to ensure that everything that happens is above board. Thanks.
Teko ana yokariyo yu isumalo takapata kitungangin ni okadlakatia ko yemo amalut isumalo takakutin ubalo ni tana makutok tayo kung kaputi libin mo nga maligong magutit maligong nang nato tayo manalota ko at kano tukisiw makatigit ya kasuglutin.
So I noticed this for the mobile clinic happening this next week or so. What's the impetus or reasoning behind hosting a mobile clinic here in Iqaluit? Nuna siya timi kawisak katamata namero ya taksuti Iqaluit iloni kanoy kisumo pidyo taksuti tayo manipan.
For surveillance testing and other activities, the goal is to reduce or eliminate every barrier that we can. And for some people, getting to the cadet hall is still a significant barrier to participate in surveillance testing. And so this makes it easier for people to get tested.
Naoyo yatuni kawisauti kawisauti na sukatigo amulutay man na kawisaktaw kuyay na rigaro katigo ilanikot kada sala gasugasa unga silo ariyaw kataman tayo na itilyo idluit kanagiyang inyo katagasong nasay tamakko kawisaktaw yumayuit atuin nakagyo tiya suglutin.
Kent Driscoll, APTN National News. Dr. Patterson, the two students who tested positive, what's their condition like? How are they doing?
Kent Driscoll, APTN Mingato, Teko Makoiling Yati Kanipang.
They're asymptomatic and staying home.
They man Novana Dramo Kanu Novana Dra Kanikoing Tiasuti Novana Dra Katuna, terminating a Maruana Kasimat Lutimana.
Vaccines for teenagers roll out this week here in the territory, and schools are open all throughout the territory. I'm wondering why here in Iqaluit are we going for the mass vaccination plan, the mass clinic, as opposed to just vaccinating the students at school?
Tabani pinsuaw sa riyatinin tama kaputi piganera matamakut tokotitinun amalo ilinya be matuinga tidlugil kanoy matabani Iqaluit Solo kikulimano ngayon toga ngayon idlo mo ataw sa mo tinapisi kanoy man ilinyawan mo ngapisi.
Because staff would have, it was an operational decision, because staff would have to be at each school for 2 days to get both cohorts in each school, and even then there would be some children who, or some youth who would be missed. So it was felt it was easiest to just do a mass clinic, and that would also allow adults who are in clinic, or sorry, who are not vaccinated but are in Iqaluit, it would give them an opportunity to get vaccinated as well.
Temen kena koyod lutin ilo ang napang ko ilaw man solo ilinyabi mo ko niyakotin udlo ni makonit piliriya ka drayang mata temen na ilo maataw sa mga yumi ilo ang naksamin temen na itiligun ilang makutu ilinya mata tek nga kaya lutin amalo at inaw yu kapoktarong kutitek nga namin matatay man na takot ataw sa mga nagsawdlugit takot kanaya tingin pilirayon ng nagsaw niya mata nako nagsawdutin.
And also just to add to that quickly, the timing of the year. In a month, kids won't be in school, so it makes no sense to vaccinate them for their first dose in school and have no follow-up plan for that.
Malo at kahit tiga ako madlugot ako ilinyawi matuligarang mata ilinyawi mi kapoktarong naglutin ilinyaw na tilugit kapoti nadliya ko kaya makya.
To the Canadian Press, Dr. Patterson, please. We know there's 21 contacts with the cases. I'm wondering, at the school, I'm wondering how many people total are in isolation right now in Iqaluit.
Takot ukakawawit 21 nguyuit ilinyawi aniteli titaw si magyuman na katsiwat 21 nguyuit kawasak taw yuit katsiwat aniteli makuyaw yuit.
I think it was just over 50 as of 7:30 this morning.
7:30 piga 50 luaparit anak sa makuyaw yuit.
Going back to the outbreak at Mary River, I'm wondering why the outbreak, why people were sent home. Why couldn't people isolate on site? And why were people sent back down south?
Takwa nuruya misano kanui mateka ni nuruya ni nuvarna drafti lugi teka ni titaw tu nalawngi dat kanui ma anak kamu utak titaw ropan.
Simply, the mine doesn't have capacity to isolate 1,200 people on site.
Temen na 1,200 ni ikanayakti ni teka ni nuvarna drafti lugi teka ni avik toktaw yung nalawngi ninyo.
Sobiutak CBC kuni takwa ilinyak tui aksang ni mitwa ilinyak tui kawi hausi mangmata kawi magayak pi asingit ilinyak titaw yun mga aksang ni ilinyak mitwa pigarok titugo. Even though the cases were found in Naksangli Middle School, would you know if there's parents who are not letting students go to school in other schools?
So again, the cases weren't found at Iqaluit School. These were children who were identified through contact tracing who happened to go to that school. And I'm being very specific about that because it's important that we be very clear that this is not a school-based outbreak or transmission. And I'll let that get interpreted and I'll answer the proper question.
O karet tiaw mabunga amalo kawi tiaw mabunga takwa nuvarna drop taksima yun ilinyawi mi pilawng mata teka ni anak kaksima lutin nuvarna drop teka nga piyaw ni kuman ta na ilinyawi pigyaw niyo si mangin man.
So yes, I do know of people who have kept their children home today, and that is an individual parental choice, and parents have the right to make that decision themselves.
I kawi mayunga ilangi ana yokkaat ilinniara tingituin ilinniartinginin teeman neetit lugu taakua ana yokkaara yauyui nammini qini qodlutin teeman na ilinniara sumammatam.
When do you think you will know it will be safe for everyone to go back to school? Kanga kakugudi kawi magayakbi kanitinang nakto ikikudi ma ilinniarakannaron naksimanga.
We'll be able to make a better or more reliable risk assessment later today once we have more results of swabbing from the people who were in the classrooms with these two individuals.
Kawi manaksaw na tugu takuad kawi saktaw yuiman na takuad kanwili kawi yaw yakit pata teeman neetit lugu takuad ilinniar binu ilawani ilokti time kawi saktaw mataman na takuad kawi malaraptigut nalo na ireakan ni unang naktabu udlumi unukan na ubalon ni kaupan.
Dustin Matardan at CF News. Do you have an update on hospitals or medevacs?
Dustin nunatsak mingatuk kay tigakan na tigo takuan anya mo kangatagaya katapit ubaloni tuwang naktuko katatu.
There were two individuals who stayed at Kikitani General Hospital last week for a day or two each. I'm not aware of any new medevacs.
Kawi madlunga takuan mako anya mo tabani Kikitani anya vingani kalauti kisen tuwang naktuko outdust tayo karamaki akawi mananga.
8 new cases we've seen over the last week. Do you have a rough breakdown of the ages of those people?
Takuan man no one not to hatri akago kutingin ni kawi maki.
6 are adults, 2 are under 18.
6 nguyi inne mako sugusi.
Sure, right, Nunavut News. Without giving any, I guess, specific personal details, how did this particular outbreak spread from last Thursday?
Tako atingin ni kawigi ng travel right. Tako atingin ni kawigi mangtunga kisen tan na kano nunalin ni sa makadra o ba?
Through indoor gatherings where people weren't wearing masks, and then into households, and the majority of people have acquired it through household transmission.
Tako idlo ni katilaw ningin nun amalo tayo na matwasima katilaw ng natin tayo na itidlo tako idlo sa makbiwad lerapon. Ano kakayo yun sa makbiwad lerapon tayo na tako ng anubang natong.
Sorry, I should correct myself. The majority of people have caught it through spread in their own home.
Akiya dudlugo mamaya nang akiya kanang dudlugo tayo na idlo anak kakatigi ngunyo tayo na tan sa maktaw sa mayo.
And do we have updated enforcement report numbers?
Amalo tayo na tako kanu enforcement policing wa kuno kay pilirayo ni kan katsiulupan.
So nothing since the last time I gave them to you. I believe it was on Thursday, but there's no fines, warnings, anything like that have been given out in the last week or so.
Pensao sulok na kita kumin na kay tunilok tayo tayo na iling alok tu udem pensao sila ta magkuha pasiyas sa may tuniyaw si mayokang ito amalo akliya kaya kanin.
Emma Tran to the Canadian Press, Dr. Patterson. At what point right now would you alter public health restrictions in Iqaluit?
Tako Emma, Canadian Press. Tem kanong akia rutin saki nyapin ta bunga karon.
If we start to see explosive growth like we saw at the early stages of this outbreak, or if we start to see a lot of community transmission where we can't establish links, then it's would be appropriate to bring back some tighter measures.
Tamani niriunang ito amit sakit nuwan na ito amit sakit to kakadlik kanapan umparon ni teko nunalimit solo teko akaw sakta yi katilaw ningi patat nunalinito naron na kung ni kadapan teman na adji kano anya kam nang itulari na atwaga kanong ni sakti gumapugot kasi naman na temen nailingan ito.
And could you tell us what that would look like? What would roll back first?
Kahit tiga kanong napitigo kiswi sibudliw kaya katamak ko atulak tao kuyaw nito.
It would depend. We'd be looking at what, how is the transmission being driven, and that varies from time to time in outbreaks. So at first we try and be selective. If there's specific areas or types of gatherings that are driving spread, the appropriate step would be to focus on those first.
Man nalo naktuta na kiya kaya tema ko kanu ileo padliya yang inin amalo kanu kawi padliya yatini tukisinak setiap pakisya ni tema nalo na kunite na kaya to tema ko nigo kanu aki ya kan niga kang nikada pata so lupo pula ya kang ni ubaruni kating kataga kang ni tema ko niwan na drata padliya tukisi padliya tukisi malagatigo kisyan tamakwa kaya ako nang natama.
Anybody else? No? Okay. Thank you so much, Minister Aliaga. You're a superstar. Really appreciate it. We'll see you all on Thursday.